I was not planning on becoming an expert in rare disease research or learning so much about drug development. But when I look into the eyes of my son and my daughter who have SLC13A5 epilepsy, I can't imagine doing anything else with my life. SLC13A5 epilepsy is a devastating genetic neurological disorder. Babies start having seizures shortly after birth, and as they grow older, they become trapped in their bodies, struggling to speak and to move. My children were among the first in the world diagnosed with SLC13A5, and when they received a diagnosis, we realized there was no infrastructure in place, no network of doctors or families or researchers. I started the foundation in order to change that. TESS Research Foundation literally started out around my kitchen table. This small but mighty organization with the lofty goal of finding better treatment options. That evolved into pretty significant funding of basic translational and clinical research. Our biggest excitement to date is that we have a gene therapy heading into clinical trials. This is the very first medication developed to address the underlying cause of this disorder. So for our community, this was a medication that we started developing with an academic partner in an academic lab. Eventually, a drug company came in and carried this drug along for a while. When that stopped being feasible, they were able to hand the program back to TESS Research Foundation, and now we are able to carry it forward to clinical trials. TESS Research Foundation is driving research for SLC13A5 epilepsy, and we're making sure that we keep the patient at the center of everything we do. In our gene therapy trial, we are excited to be the sponsor and grateful that we get to make sure that our protocols really address what is meaningful for families and what is feasible as we move forward with precision therapies. This is an unusual situation and a real testament to the amount of collaboration that happens in the rare disease space. Drug development for a disease usually takes 30 years, but we've been able to get that down to less than 10 years. In other scenarios, this drug would have been left on a shelf and our potential cure could be out there and never see the patient population. TESS Research Foundation, like so many now in the rare disease space, are truly driving drug development and driving rare disease research forward. Our organizations are working together to really turn the tide on rare disease research and health as a whole.